Tanya is a coordinator of adult services here at AANE. She received her master's in expressive arts therapy and mental health counseling from Lesley University. At AANE, she organizes and facilitates social and support groups for adults with AS and related profiles. She provides clinical consultation, training, and one-on-one anxiety management training. She also leads art therapy groups for students at Mass College of Art and Design. Her past experience includes leading drama-based social and life skills groups at the Spotlight program of the Northeast ARC. Welcome, Tanya.
Hi, thank you. Can everyone hear me okay? Hi. So I guess we'll get started. If anyone has any trouble hearing at any time, you can always send in a chat, just like Joanne said. And I will get started now. So first of all, I want to thank you all for being here today. I'm really happy to share some techniques on managing anxiety because this is a focus I've really brought a lot of attention to because I think it can get really in the way for a lot of people and you can experience life too. In a better way if you can just get those anxious thoughts, those anxious experiences in a little more control. So before I dive right into the content, I just want to ask everyone to take a minute to check in with where you are. Just check in with where you're sitting. Try to be here right now. And thank yourself for being here because it's really healthy to spend some time sitting and connecting with ways that you can make your own life a little better, or if you're here on behalf of somebody else, I just want to thank you, and I hope you thank yourself for being here. So we will dive right in, and again, as Joanne said, if you have questions on the way, or if you can't hear, or anything like that, just go ahead and send a chat in, and we'll respond to you. So consider today an overview of your options. I'll talk a bit about understanding anxiety, and then I'll run through many different approaches for managing it. Tomorrow you will receive an email from me, or Thursday you'll receive an email with more information, and you can refer to that if you want to explore specific topics that I go over. So to get started, we asked at one of our conferences for adults with AS, it was called Managing an Anxious Mind. We asked a few questions. One was, what makes you anxious? And this is a little bit of what we got in response. We learned that there were some trends and specific things that make some people anxious, but we also learned that many people experience consistent anxiety in response to many parts of their life. And then we asked, what helps you feel calm? We got a lot of great ideas about the activities that help people feel calm. We also will talk about some of these, and I wanted to point out that animals got quite a few votes here, especially cats, so they're winning the game here. And I do want to point out that time spent with animals can really help some of us to focus on the present moment, the sensory experience when we're petting them or interacting with them, and they can even perhaps encourage us to get into a state where we're not thinking so hard and it makes things a little more simple. So any time that you have something that you see naturally helps you with your anxiety, pay a little attention to how that helps you, what it is that actually helps you. And so we also asked about words of encouragement. These are some things that people find helpful to tell themselves. Many of these are very caring ways of speaking to ourselves or each other, and some of them are just about being in the present moment and accepting things as they are. So take a moment even just to think about how things that you say to yourself can help you with anxiety. And I'm hearing that the bottom corner of my screen is black. I am not sure why. Sorry about that. Sorry about the bottom corner being black. Maybe Joanne has a suggestion for that. I will, if you want to send in the chat, Joanne. I'm not sure how to fix that. Hopefully there won't be any content that's covered.
I will look at it from this end and see about if we can pull up the presentation a different way. So just give me a few minutes and continue on.
Okay. Okay, sure. I will just continue on, and we might pause again to fix that up. Sorry, guys. So what is anxiety? Let's just talk about anxiety for a bit. It exists for a reason. Sometimes it's helpful to understand, helpful to understand that it exists for a reason and that we can understand what's actually going on for us, and that can help us pay attention and to know what it is that's happening so we can respond to it. So anxiety is the presence of excessive worry, and excessive worry means worrying even when there's nothing wrong, and sometimes worrying in a manner that's disproportionate to the actual risk. And so your amount of worry might just far exceed what the actual sort of concern is. And often worry persists for long periods of time. The worry may lead to symptoms such as tiredness or fatigue, restlessness, irritability, impaired concentration, and difficulty sleeping. I hear the black box is fixed. I'm glad. Okay, so why anxiety? We have, like I said, we have anxiety for a reason, and sometimes it's helpful to understand that there's some type of logic behind the things that our bodies and minds are doing, and this can also help us maybe be less frustrated with ourselves, and perhaps understanding why anxiety happens and will help us find ways to how to approach it. So a few points. Clearly, our anxiety is trying to protect us by predicting dangers so we can prepare for them. But sometimes our effort to predict and problem solve can go on for too long and also get exaggerated. This ends up leading us to take up too much of our energy preparing for what we think might happen. So when it comes time to actually addressing the moment or the issue that we're anxious about, we could be out of energy. And not only might we spend too much time on the anxiety, sometimes our imaginations are really, really good at coming up with the worst things that could happen. I like this little image here that anxiety or worry is a misuse of imagination. So just think of how good sometimes your imagination is at finding possible scenarios, but how do you sometimes follow those scenarios too closely and let them become your reality? And so this also can become a habit. If we think in a certain way, we get closer to forming a habit of that type of thinking. And so there's a good side and a bad side to this habit idea. The bad news is that it does make it harder to change our habits because we're not just changing moment to moment how we think. We're kind of working against the habit that we've produced over the time that we've been a thinking person. The good side, though, is that when we do work on these habits, after a while, in theory, it'll be easier and easier to think in our new, more positive or more relaxed way because we're creating new habits. So I want to spend a little time on specifically Asperger syndrome and anxiety. These are a few traits that you might relate to, and I want to say a little bit about how they might inform anxiety specifically. So the first is a tendency toward noticing many details versus seeing the big picture. Since people with AS profiles see so much detail, it might be hard for them to determine what's the most important. They may put more emphasis on one small negative detail when in the big picture it's relatively not as important. This may also lead someone to be overwhelmed because they notice many more of the details of a situation. And from my experience in working with adults with Asperger's, we can get to the point of seeing the big picture working together, and many of them can get to it on their own, but just think about how much harder that is in a moment of feeling anxiety. The next one is awareness of emotion. So people with Asperger's have different levels of awareness of emotion. Many people I work with say that they don't notice the gradual rise to an anxious state. They only notice when it gets to a very high level. Other people describe that their anxiety responses seem to just escalate very, very quickly. Also, people I work with notice emotional or physical responses sometimes first, but a lot of times people notice the thoughts that they're thinking when they're anxious rather than the other two. So it's important to know yourself and to know what you're best at noticing and addressing. And we'll talk a lot more about this a little bit later. So the next one is attention and impulse control. So many people I work with describe that they have quite a difficulty in controlling where they shift their focus. And many more describe that the speed at which their thoughts race through their head when they're anxious is really hard to keep up with. And there are some times where people actually have an easier time managing where they bring their focus to, depending on what the topic is. So the next one is organization and problem solving. And this is sometimes called executive functioning. And it's very common with people with Asperger's. And many people describe a difficulty with organizing and problem solving as contributing factors to the situations that are causing them anxiety, or sometimes people just have a higher drive to have things more predictable and simple. Next one is time. Not quite a trait exactly, but something that comes up a lot. It's an interesting and varied concept for everyone, and some people find that the pressures of time, deadlines, schedules can become consistent sources of anxiety, and also some people explain that they really have a difficulty conceptualizing time in general on different levels. I'm being asked to refresh my screen. Here, let me see.
So Tanya, sorry to interrupt, but what's happening here is that viewers are saying the right-hand side of their screen is showing up black, and so on this diagram that you have, the right-hand portion of it, the right-hand side of social competence, isn't being shown.
Okay, let me try to hide the webinar software. Did that change it for anyone?
What's that?
I just hid the sidebar I'm working with for the webinar. That doesn't seem that it changed it for anyone.
No, that doesn't seem to change it. So
Okay.
We are going, just so everybody knows, they will receive a copy of these handouts. So we will continue to work on it, but you will get a paper copy of this as well, or an email copy of it. So that's not, no, I'm hearing that that's still not making a change.
Okay, that is very strange. I'm just going to check something one more time.
You know, one thing that I'm thinking that, okay, there you go.
Did that help?
Yes.
Okay, I just kind of exited all out and went back. So again, I'm trying to watch the text and my slides, so keep typing in if things come up again, or Joanne, you can chime in.
All right, thank you.
Okay, good, yeah. Okay, so where were we? We were at perspective taking. So for people who have some trouble with understanding others' perspectives, this can lead to either making a lot of false assumptions or constantly worrying that you don't understand correctly. So if you are, having trouble assuming what people are thinking, you might think the worst, or you might just kind of view yourself as someone who doesn't understand people, so this will also cause you to worry that you don't know what's going on in the other person's head. And then just expanding on this, social anxiety is another experience that's really common. A combination of a history of difficult or maybe even traumatic social experiences can lead someone to have assumptions that things will go wrong. And seeing socializing as something that you have difficulty with will also lower your confidence and therefore raise your anxiety when you know that you have to be social. And also I like to point out that sensory sensitivities can cause anxious states, but also the sensitivity that you experience can increase while you're feeling anxious. So also always check in with your sensory situation. Are you being made anxious initially by something that's sensory that's going on, like the bright lights or a lot of noise, or is because you're feeling anxious, are you now feeling a lot of the sensory input to a higher degree? Next, I'm still sort of going through the overview because I want to say about how these techniques I'm about to share can be used yourself. You can, in a sort of DIY style, there's books, apps, online resources that you can look through and teach yourself. But then there's also ways that you can work with a professional or a group on these techniques. Some people might find that you'll actually do a combination. You might have a therapist, but you also do reading on your own, or you have an app on your phone. But first, just a few reasons to consider working with a professional or getting involved with some sort of group. The first is if the professional has specific training and experience, he or she can learn specifically about your situation and pull from their knowledge and experience to help you find approaches that might be more suited to you. So they're sort of able to pull from what they know and look at you as an individual and give you suggestions. Next, the professional or members of the group can also offer you an outside perspective, and sometimes that helps make it a little easier for them to be more rational than you might when you're a little more emotionally involved in the situation. Next is accountability. Working with a professional group gives you an easier way to be held accountable for your goals and for your efforts. And this isn't only about pressure to follow through, though that can be part of it, to feel that sort of pressure from them to follow through with what you planned. But they can also offer you encouragement and congratulations when you do make progress. And then lastly, it offers you a structured time and place to focus on the work. Usually you meet at a certain space that's different from what you're used to. You have something scheduled. And your work on your anxiety might also include, like we said, work on your own. But if you have something in your schedule where you're checking in and you're really devoting time on working on this, then that can be really helpful. So I'm about to dive right into the techniques now. So first is cognitive behavioral therapy, or CBT. And so this is often one that I start with when I'm working with people. It's very focused on thoughts in terms of how we first approach the anxiety experiences. And CBT essentially argues that if you can look at your thoughts and notice them and really think about them a little bit, then you can argue them and not necessarily believe them as true statements. So in all, it focuses on thoughts, feelings, and behaviors and their relationship to one another. And it also says that we all experience automatic thoughts. And these automatic thoughts mean what comes to your mind initially when something happens, not maybe after you've thought it through, but just what are the first things that come to mind. And if we draw attention to those, can we challenge them before we get sort of down the train of a very subtle thought turning into a disastrous prediction of what might happen. And also, sometimes our automatic thoughts are unhelpful, and so we call these sometimes unhelpful thinking styles, or they're also known as cognitive distortions. And so we work on identifying how they might be distorted or unhelpful. And then the next part, of course, is to find ways to untwist that thinking or find rational responses to those thoughts. So I hear the black box is back. Oh, it's gone. Okay. So again, just breaking it down a little simpler into 3 steps of challenging your thoughts. 1, we catch the thought, the automatic thought, we notice it. 2, we identify what's unhelpful about it. And 3, we untwist our thinking, we find a response to it. You will be receiving in your resources some lists of the unhelpful thinking styles or cognitive distortions and lists of the ways to untwist your thinking. So let's apply this to an actual or made-up situation. So CBT style, we look at what kind of sparks your anxiety. So the situation here is I see someone at a social event that I would like to become friends with, and I have an opportunity to talk with her if I walk over to her. So you can go ahead and think of maybe what thoughts might come to your mind in this situation. I brainstormed a few possibilities. What if I say something stupid? She probably thinks I'm weird. These things never go well. I feel really nervous, so it's probably a terrible idea. I should be able to just do this without thinking about it so much. And these thoughts probably, if you have some of these thoughts, you probably experience 10 times as many thoughts and a faster pace even, depending on how it works for you. But we start to pay attention to what thoughts are coming up. What feelings are you having? Feeling nervous maybe, embarrassed, physically feeling, having sweaty palms, a tightness in your chest. And what behavior? Well, there's a lot of different behaviors. I thought I'd go with the sort of anxiety wins, but I decided not to talk to her and I joined another group instead. So let's take time looking at the thoughts, CBT style. So first, we're going to look at each thought and look at how it might be unhelpful. Again, the names that I'm using in the right side of the chart are going to be an information that you'll receive later on. So what if I say something stupid? Well, first of all, you're jumping to conclusions, or sort of predicting the future of what might happen. You're not sure necessarily what you might do. So it's not really fair to assume the worst. And also you're labeling a little bit. The word stupid is a pretty harsh word. And so check in with, is that really the word that you want to be using about the things that you might say? Is that appropriate? She probably thinks I'm weird. So you're jumping to conclusions again, but this style is mind reading. So do you really know that she thinks you're weird? Is it really fair to assume that? These things never go well. This is an overgeneralizing. Every time you use words like never or always or the whole world or anything like that that's generalizing, consider that it's possible that you're making an overgeneralization, that the other one is using a mental filter, that you're thinking back to all the experiences you've had socially that didn't go well, but you're filtering out the ones that did. So I feel really nervous, so it's probably a terrible idea. This is what we call emotional reasoning. So this is when you feel an emotion and you let the emotion inform your perception and your thought. In this case, maybe it's not really a bad idea at all, but I feel nervous, and so I think it is. Or maybe it's a little bit of a bad idea. Maybe I'm not sure what to say, but I feel so nervous that I think it must be a terrible idea. So it also could have something to do with how extreme of a reaction you have. I am not moving my mouse on the screen. I hear the black box is coming and going. We could just call that our anxiety, maybe. We can just be present with it and hope that it goes away. If it stays for a while, you guys can keep chatting in and letting me know. So I'm going to jump ahead to looking at our thoughts again, and this time instead of identifying what's unhelpful exactly, we're talking about identifying how we could respond to those thoughts and make a bit of a change. So what if I say something stupid again? In this case, we talked about labeling, so let's define the term stupid. Think about what the word stupid really means to you, and is that a word that you want to sort of have a habit of repeating to yourself, and is it really a little too harsh? Maybe, what if I say something not as interesting as I'd like it to be? Something like that. Is stupid really the word that you want to go with here? So she probably thinks I'm weird. I'd say examine the evidence. Like we said, are you just making assumptions based on evidence that you either made up or that you are only looking at the negative? See what you have to look around and figure out. And also when you examine evidence of an assumption you're making, try to be a scientist about it. Don't let yourself be so led by your hypothesis. So you just look for all of the evidence that'll lead you to being right, because sometimes being right isn't so good when you're assuming the worst. So these things never go well. Again, examine the evidence. Look back and think of all the times they have gone well. And also try thinking in shades of gray. So, what does going well mean? Does going well mean that you're instantly connected with this person and have plans with them and everything is happily ever after? Or is going well meaning you have a short conversation and you say a couple interesting things, maybe you laugh, she laughs, and that's all. But that's pretty well, I'd say. I feel really nervous, so it's probably a terrible idea. In this case, maybe even just identifying the distortion that you're using. Like we said, this is sort of emotional reasoning. So if you can even step back for a second when you have this thought and think, okay, I'm reasoning based on the emotions I'm feeling, and I realize that that's something I do sometimes and it's not always true. So I should be able to do this without thinking about it so much. So one of the methods here could be the survey method. It could be asking around to other people you know, asking them if they've ever felt like it's difficult to initiate a conversation. I bet you'll get some yeses. The other is the double standard method, and this is when you think about what you would say to a friend. If a friend said to you, I was at this event and I tried to talk to someone, but I was too nervous, what would you say to them? Would you say, me too, I know that's really hard, so why can't you talk to yourself in that more caring way? So I'm going to go with a bit of a deeper, more big picture element of the CBT perspective as well. And this is the identifying of and possibly the challenging of our core beliefs. Your core beliefs are the most general beliefs that you have about yourself, about other people as a whole, and your beliefs about the world or life. And this might be on sort of a more existential or perhaps spiritual level. So for example, consider how a core belief about yourself that says, I'm not important, can change your thoughts and experiences of life compared to something like, I can make small amounts of change by treating others well. Think about and these might be a little hard to identify sort of on the spot if you haven't thought about this before, but just think about the beliefs that you have about yourself. or a belief that most people are inherently prone to compete with one another in order to get what they want, versus another belief of perhaps that people ultimately intend to do good, they're just sometimes misguided. And then world, this could be a belief that things will all eventually go wrong. Murphy's Law, if anything can go wrong, it will. Or you could say something like, things will often go different than you expected, which sometimes might be good, bad, or neutral. And so just becoming aware of these core beliefs can be really helpful. And the core beliefs you find might be very strong, or it might be more nuanced. Your core beliefs may also be things that in a rational state of mind, you know they're untrue, but they're still beliefs on some level that inform some of the perspectives you have and the choices you make. And most of us really are not explicitly aware of our core beliefs at this point unless we've done the work to look into them. We don't say these expressions out loud or in our heads on a regular basis, but with some self-awareness, we start to practice noticing sort of what's informing the thoughts that we're having. So on to the next topic here, we have mindfulness. So mindfulness is a practice of focusing on the present moment and building awareness of our thoughts and our experiences, and accepting those experiences as they are without judging them. The idea with mindfulness that's different from CBT is with CBT we were kind of looking at our thoughts and arguing them and testing them and trying to shift them. Mindfulness is looking at our thoughts, noticing them, and realizing that we could possibly just let them go without engaging with them. The idea is that when we allow them to just be without engaging them, we can just let them pass and maybe focus in on the present moment or something else that we are interested in or something that makes us happy. And so this really encourages us to just see our thoughts as a process of our brains. They get a little bit less power over us when we see them in this way, and that they are just thoughts, they're not necessarily true or real. And also, being mindful can ultimately lead to more patience and compassion for yourself as well as for others and for the environment around you. So think about how much patience and compassion it would take to be mindful, to just notice your thoughts and just to let them go. And so that's a learning practice in and of itself, and being patient and compassionate to yourself is really helpful. So we just went over mindfulness in a general sense, and when it comes to incorporating mindfulness into your life, I want to break it down into two parts, actually. I think that some people turn off to the idea of mindfulness because they're introduced to certain well-known interpretations that don't happen to work for them. So I'd like to offer a couple perspectives on this. First, there's the practice of mindful strategy. And so probably any of you have heard about mindfulness before today would first think of meditation or breathing exercises. And you may have a whole variety of opinions about those. Meditation in a traditional sense is just being still, usually sitting, allowing your thoughts to just pass and just let yourself have a neutral awareness of your thoughts, along with any emotions or physical sensations that come up. And breathing is a common focus that you use in meditation because ultimately meditation is about just awareness, but that's a pretty abstract concept. So we just start by practicing being aware of something that's kind of neutral. And our breath is something that happens involuntarily in our bodies, and it's also something that's always there. It's always something we can go to. So if we practice noticing our breath, it's something we always have access to in every moment. But this might not be right for you because you might need something less subtle, especially for some people who experience a lower sort of body awareness. Breath might not be something that you feel like you can as easily check in with and engage with. And also, if we're talking about anxiety, some people might really experience their anxiety specifically in their breathing, some tightness of breath. And so for some people, focusing on the breath helps you to relax and change that. But for some people, if your breath is really one way that you're exhibiting anxiety, then focusing on that might just kind of make you get more and more anxious. So knowing yourself is important. And so also, this is where activities might come in instead of using the breath. You might choose an activity that you enjoy, like exercise, video games, drawing, and more. I'll cover more of this in coming slides. And you can turn about just any interest of yours into a mindfulness practice by intentionally using the time that you're spending on that activity as time to focus on that activity purely in the moment. And you might even not need to intentionally intentionally make an activity that you use a mindful activity because it already is, because it's something that engages you so much into the present moment that you don't have to sort of intentionally make it that way. But if you already have an activity like this, take advantage of that to learn how it is that you can practice to be in the moment, practice to be focused on something that makes you happy. And so then there's the use of everyday tasks. So these are less of your interest, but more just things that you do all the time. So I once heard a suggestion of practicing mindfulness every time you wash your hands. And this is something we do multiple times a day. We already have to do it, so it's already taking up some time. So why not make it a time where you're intentionally bringing your focus to the present moment? You might do this by paying attention to the feeling of the soap and water on your hands, the feeling of your hands rubbing together, the sensation of drying them off. And you just had a little mindful moment that maybe made a bit of a break in your day, especially if you were coming from a situation where you're feeling a little anxious. So just think for a moment, too, about other things you do all day long or once a day or very often in your life that you don't have to be focused on a lot of different things. You could really just focus on washing your hands, on the walk you have to take up or down the stairs, things like that. So now into the category of mindfulness as a concept. So in the previous slide, we already talked about this in a little more detail of how mindfulness suggests non-judgmental and patient awareness. But also just a few questions for you of using mindfulness as a broader concept in the way that you look at yourself and at your anxiety. So can you decide to have a little intention of looking at yourself, others, and the world in a more compassionate way? Are there times when you can accept things as they are, even if you may not want to? And could letting go of resistance of the way things are allow you to have a little more patience and energy to devote time to the positive aspects of your life? So moving on to specifically physical approaches to anxiety, I feel like this is deserving a category of its own because it has already shown up, I think, in all of the other things we've talked about, and it will continue to show up as an element. But you have a lot of access to affecting yourself and your anxiety when you think about the physical aspects of it. So first, let's understand the biology. When your body is naturally getting ready for fight, flight, or freeze in an anxiety-provoking moment, you're reacting as if there was an actual physical threat. Your body is reacting that way. So think for yourself, even for a moment, do you tend to get into fight response or flight response where you want to just get out of the situation or freeze? Do you feel like you can't move or you don't know what to say or you can't think? How does anxiety present to you in these sorts of ways? And understanding that this is a body response, a brain response, that you might be reacting a little stronger than is necessary, you can maybe try to end up using some physical techniques to calm that down a little bit. For example, when your body gets pumped up with this energy and transitions into this state of fight, flight, or freeze, then sometimes you need to release the energy physically or find a way to help your body move to a more calm state. So physical manifestations of anxiety might be tension, shortness of breath, your heart might be racing, you might be sweating, you might experience some weakness or some excess of energy, or you might feel some inertia, you might feel stuck. So let's talk through some options for physical strategies. First, there's exercise. Remembering how breathing isn't enough for some people. Sometimes exercise is a more extreme intervention that can help you to release your tension as well as refocus to the present moment. Also, in any types of these exercise methods that incorporate more strenuous training to teach your mind and body how to work through pain and challenge, this is not so different from teaching your body and mind to work through the pain and challenge of anxiety. And also some strategies such as yoga, intended for relaxation, can help guide you through relaxing your mind and your body at once, especially if you're in a yoga class. The teacher might talk about how to both work on your mind and your body at once. So next, let's give breathing a chance. I know I've mentioned a few times that it's not right for everyone, but for some people it is right, or after some practice with it, it can be really helpful for you. Changing your breathing by taking deeper and slower breaths can sort of trick your body into its relaxation response And this is sort of the opposite of how your mind and your thoughts can sometimes trick our bodies into anxiety responses. So we can sort of take advantage of the opposite and think, how can I teach my body to calm down, to transition into a different state? And there are also more subtle physical strategies, such as squeezing something to release energy or playing with something in your hand. And this can help you to bring your attention away from the anxiety or the thoughts that you're having. If you have something in your hand, and you can, just like I kind of described washing your hands, if you have some sort of fidget toy or stress ball or something, if you can bring your focus instead to the object that's in your hand, that can feel grounding for some people. They can feel very much more in the present moment. They can feel like a little stronger, that they can handle things, or it even just distracts them for a moment from their thoughts before the thoughts sort of race out of hand. You also might try things like standing if you were sitting, or sitting if you were standing, or going to another room. You could stretch the part of your body that feels tense. This is especially helpful if you're in more of a freeze mode. If you can't seem to find the momentum to do something directly productive to help your anxiety, just doing something might get you moving enough so that you're not so stuck. So think about just how you can incorporate some movement to get yourself going. And we also mentioned before that sensory stimuli can be causing your anxiety or making it worse, and see if you can either remove or soften some of these in situations. There's also biofeedback approaches, and I'm by no means an expert on these, but this is a technology that's recently getting even more attention and development. Biofeedback is essentially when you have a way of measuring an actual body response, such as your pulse, usually using an instrument that gives you concrete measurements, and with this specific knowledge, your body's state, and you end up practicing techniques of changing these body states at will. So how can you change your thoughts or change your breathing and actually notice a change in what's going on for your body? And like biofeedback, I can't speak to the details of using medications to manage your anxiety, but I do want to point that out as an option. You can talk with a psychiatrist about options, and for some people, medication is a really helpful supplement to all of the other strategies that we're talking about today. It can help you get to a state where you can feel calm enough to manage and to try out some techniques. So that's also an option as well. So now I'm going to dive into some interest-based techniques. This list is by no means exhaustive, and when I say interest-based, I don't want you to assume that you already have to have an interest in any of these topics I'm about to bring up. It's possible that you could try something out that's new to you, and it could become a new interest, or you could find something about it that's really helpful. So first, let's talk about using visual art. As Joanne mentioned, I'm an expressive arts therapist, so I often will think about ways to bring in the arts of many forms into the therapeutic process. And so these are just a few ideas of considering how art could become an anxiety management or processing technique for you. Sort of in a few different categories, there's expressing your anxiety through art. So for example, you might draw or paint really quickly using the tension that you're feeling from your anxiety in your arms or your hands and just letting that out. Sort of like that image I chose at the very top. I can imagine someone doing that. I think it's actually a digital image. So if you like working digitally, you can work in this way. You can create an image that represents what your anxiety would look like if it was on the page. For some people, this relates to sort of letting out that tension, but also for some people, seeing their anxiety represented in front of them can help them feel like they can remove themselves from it a little bit and look at it. It's not something that just exists sort of in the darkness of a mystery inside them, but that now is sitting in front of them and they can think about it a little more clearly. You can also look at artwork by other people that represents their anxiety. This might be sort of cathartic in similar ways of seeing it represented, but also you can know that someone else created this representation of anxiety, and perhaps it's something that feels like it really represents what you're feeling. And just knowing that there are other people out there experiencing anxiety in similar ways can be really helpful to know, so you don't beat yourself up for the experiences that you're having. Next is focusing on something positive when you're drawing. So the first part here was more focusing on the anxiety, but you can also just even focus on creating art on a subject that you enjoy. If you really enjoy landscapes, or you really enjoy animals, or you like a certain color, work with that. Just try to bring your focus to something positive. And again, creating art or looking at art that represents calm or something more positive for you can be helpful. Also, there's the approach of just plain more purely focusing on the process of making art. So less thinking about what represents your anxiety or what represents calm. It's just getting into sort of the flow of making something. A lot of people might do this by coloring, color pages, and there are a lot of sort of adult coloring books out there in stores and online. So if you want something a little more detailed, or you want something that's like a mandala circular shape, or if you want to try Zentangles, this is the image of a Zentangle on the bottom here of this page of breaking, you basically break different sections, and it's called meditative doodling, where you think of any times you might sit and doodle, but this is sort of a little more intentional, like you decide you're going to sit and spend time and just focus on the process of playing with shapes and patterns. So next, I'll talk a little bit about music. It can be approached in a lot of similar ways that I just described with art. Again, you can play music on an actual instrument or sing, or you can listen to songs that represent anxiety for you or represent a calmer state. People also sometimes really love using lyrics as mantras or mottos or whatever you want to call them during your anxious times. So if there is a song that you really relate to, you really connect with, that helps you feel calm, make sure you remember those lyrics that stick out for you, or even just the tune of it could help bring you to a state of connecting with that sort of way of looking at the world, or that sort of calmer way of being. And I think the beat of music can be really helpful too, to sort of bring us into a different state of mind, sort of like how changing our breathing can change the way that it can slow us down. It can, even listening to faster music can sort of speed us up in some sort of way. How can the beat of the music as well as the lyrics affect the way that you're experiencing your situation? Writing is another outlet. Writing is probably the closest type of creation relative to the way your thoughts come through your head. So just think about the fact that if you're using the part of your mind that is thinking to write instead, then that's kind of very directly distracting yourself from just getting caught up in your thoughts. Perhaps you're even just writing your thoughts out on the page. But again, that sort of becomes an external way to express those thoughts and to make those thoughts be seen more concretely, so you can either look back through them, or some people see it as sort of dumping their thoughts and feelings onto the page so they can let them out in that way. You could also use writing to be sort of in the present moment. If you were to sit down and write about sort of what you're experiencing in this moment, that could be a little more of a concrete practice than just trying to sit and think about the present moment. You could also write to take yourself away to a different place completely. You might write about a fictional story or place that really makes you happy. You can also use writing to communicate something that you don't have the opportunity to say, or something that's difficult to say. So if part of your anxiety is being created by sort of a communication problem with someone, or something that you wish that you could tell someone but you can't, can you maybe express this in a letter or in a journal entry that maybe you won't even show the person, but even just letting that out and processing it, maybe in the process you'll also learn a little bit about how to communicate a little bit easier. And so you might also write to think things through, to make sense of them yourself, as I said, either communicating with other people or making sense of them yourself. I mentioned a few of the types already. Another one's poetry. Some people might find poetry helpful. One thing about poetry is that if you sort of write in verses, you're actually changing your thought pattern a little bit from just writing free flow. So it causes you to kind of stop at different lines of the poem. And so this might kind of just shift the way that you're processing through the information in your head. So last category of interest here is I lumped together sort of theater, movies, TV, video games. They're all sort of this type of multimedia storytelling. There's the visual aspects. There's the sound. Often they incorporate music. And really, they're a great opportunity to let yourself escape into someone else's story. You can also learn from someone else's story. You can also laugh about someone else's story. I think humor is a really big piece, both in this category and also just in the way you look at your life and your experiences. If you can bring in some humor, sometimes that can lighten up your mood about it. And not only experiencing of these categories, but if you want to try acting or improvisational theater, you can immerse yourself into another story in that experience, or you can even, especially if you're doing improvisational theater, you can improv about your own experiences and explore that a little bit. And also participating in acting or improv is a good way to practice social interaction. So if social anxiety is a big part for you, then you might try this as well. And with theater, with music, art, and the physical sort of dance aspects, there are expressive arts therapists around the greater Boston area especially, but all around the place. And so if you want to have a little help, like we talked about working with professionals, then AANE can help you connect with some expressive arts therapists who might help you to figure out how to incorporate these different things into your way of processing your anxiety. So I'd like to finish up, and then we'll actually open up for questions. We have quite a bit of time for questions, so that'll be good. We get to have a bit of conversation going. But just as a sort of review, I want to step back and look at the big picture again. So just a few ideas to consider. In my work, I tend to try approaching thoughts first. So this isn't right for everyone, but many people spend a lot of time and energy focused on their thoughts, so I figure why not start there. So if you're just getting started or you're not sure what to try just connecting with your thoughts first, because they're usually pretty clear for a lot of people. And also, it's helpful to come up with solutions to specific situations, but make sure that you're also understanding the process that led you to come up with a solution. The more you can learn the skills to approach any situation, the more you'll be able to repeat those skills on your own. And also remember that the skills need to be practiced, so if they don't completely work the first time, this doesn't mean you failed. It just means you're just starting to learn. Also, check in with your perceptions of yourself and the world. Notice any time where you're considering yourself to be struggling with this on your own. There are, how many of you? There are 42 of you signed on right now, and I think about 100 who signed up to view this webinar at some point. So just take that into consideration and consider that there's probably a lot more people who are going to run into this webinar later on and find it helpful because they're struggling with anxiety. So you're definitely not alone in this. And we all experience anxiety differently and at different levels, but it is something that we all are experiencing. Another one just to highlight is just consider ways to focus yourself on the present moment. Think about how much you spend time on the past or on the future, and think about ways that you could bring yourself to right here and right now. And lastly, give yourself something more concrete to work toward, or give yourself a way to measure your progress along the way. This can be a really gradual learning experience, and we all need moments where we feel some success to give us a little burst of momentum to keep going. So practice also noticing what direction you're going, when you're making progress, even if they're little small parts, even if something did not go perfectly well. Think about how it went better than it may have a couple years ago. So check in with that. So that's what I have to say to you guys for now, and I would like to open it up to questions. You can type in your questions to the chat box, and I will be opening that up and taking a look to see what people are saying. And I will not use your name. I will just sort of paraphrase or read out your question and offer some responses. And so I have a question here from a parent about alleviating her son's anxiety, that he's on the spectrum and he's very, very anxious. So I'm not sure how old your son is. I will say I have only worked with adults, and so adults and older teens. So a lot of my perspective is going to come from that type of experience. Okay, 15. Okay. So I would say look through the techniques I went through today. Look through how maybe using the CBT or mindfulness perspective could change maybe the way you suggest that he looks at a situation in a different way. Maybe if he's seeing a therapist, talk with a therapist about the specific techniques that they're using, see if you can use those at home, and also check in with the sort of interest-based ones that I suggested. Think about how his different interests might be ways for him to process his anxiety. Okay, so it sounds like he's responding to a specific issue at his school that he's really nervous about. I'm reading the question. Okay. So, I mean, it's also different when there is a specific situation where you're reacting to one specific trigger. We're talking less in this case about your overall anxiety and practicing managing it and looking at your situation in different ways. I think that if there's a specific threat that your son's reacting to, then perhaps writing out the different things that he's nervous about it and coming up with a plan about, you know, what are my fears that are reasonable to, you know, consider, and do I have a plan in response to those? And what can I do to help myself take a break or feel calm if I start to worry about this? Where's a safe place for me? Scrolling through the questions again. Okay, I have another question here about having severe fall allergies and a minor case of asthma. And so when this person's allergies kick in, they start to have trouble breathing and panic big time. So how do you calm yourself down? This is a really good question because a lot of times physical symptoms can very quickly escalate because all of a sudden we start reacting to how worried we are that things are going to go wrong, that things are going to get worse. I'd say check in the moment when you start panicking because of your breathing. Remind yourself that the best thing that you could do for yourself right now is to be calm, to know which steps to take. Perhaps that's having written down, I start to feel my asthma experiences, and you have a few steps. Okay, I need to check in and see, you know, rate them on how bad they are. These are the things that I need to do. I need an inhaler, or I need to do something. I need to take a break. Have the steps logistically of what you need to do in reaction to the symptoms, but also check in and notice, are you catastrophizing? Are you thinking of, do you start to feel tenseness of breath and then you picture yourself in the emergency room? Like how are you predicting how things might go wrong? How might that make you be panicking in that moment? Scrolling through the questions again. So I have a question here about, what do you think about creating a code word to help someone who's experiencing high anxiety come back to the present and calm down? So I think that's a really great idea. I think having a code word or a code phrase for anyone to check in with yourself. I think I like to tell people, even if you notice that you're feeling anxious, you notice your thoughts are unhelpful, but you don't do anything to fix it, that's still progress. Noticing it is sort of like taking a pause. It's cutting in between the sort of train of thought. It's the first step of the practice. So if all you do for now is say, okay, feeling anxious, watermelon, then, you know, at least you've paused for a moment to think, I need to use a strategy. From that space forward, you might be able to say, okay, watermelon, take 3 deep breaths. And, you know, you can break this down into a process, but I really love that suggestion. So let's remember that. Creating a code word, or I mentioned sort of the term motto or mantra, if there's something that you can say to yourself like, I can get through this, or ultimately everything's going to be okay, or I'm here right now, I'm breathing, I am, you know, my feet are firmly grounded on the floor. Whatever it is you can say to yourself, it is nice to have something, a code word, something to go to quickly, so you don't have to think so hard in the moment where you're feeling anxious, if you have something to go to very specifically. Okay, let's see who's up next. So I have someone asking here about transition, about someone who is experiencing anxiety, gets stuck, and can't transition from classes. So this is a really good question, too. A lot of people have trouble with transitioning from one experience to another experience. And this also reminds me of what I said, too, about how, you know, if you're in an anxious state, can you just move around in some way to kind of create a momentum to shift to another experience? So I'd say practice if there are ways to create sort of concrete endings and starts to the old experience and then the new experience. Is there a way to sort of, if breathing exercises help, or sort of a quick grounding meditation helps, or perhaps there's some sort of object so that they have in their hand that they can ground themselves with, of saying to themselves, okay, this class is done, and this is one thing I learned, and I am going to just take one deep breath before I get out of my chair. And then getting to the new space, and I think the new space especially, checking in with, one technique I didn't mention in the presentation today is, I call it either 5, 4, 3, 2, 1 or 3, 2, 1, depending on which approach. Let's go with 3, 2, 1. It's basically checking in with your senses. And so if we call it 3, 2, 1, it's a little simpler. I might say, sit down in class, think to yourself 3 things you see, then think to yourself 2 things you hear, and then think to yourself 1 thing you feel. And this can sort of get the person into the present moment. So I hope that feels helpful for that situation. Okay. Lots of questions. Bear with me as I scroll through. Oh, another really good question here. Are there risks with using an Asperger's focus area as a focus for addressing anxiety? Our son has done borderline obsessing with writing music, and so would it be risky to focus on that for addressing anxiety? So when I work with my one-on-one clients, I always bring up this as a potential thing to consider if they are saying, it especially comes up with video games. If someone really finds video games as something that helps them de-stress, I check in with, how much time do you spend playing video games? Can you take a break to play video games? But also, when you start playing video games, how easy is it for you to stop? How long do you have to play in order to feel that de-stressing experience? So how long would you have to write music to feel that de-stressing level of experience? So checking in with them and finding the balance of if this person feels like they can have some structure in, setting aside an hour to write music and that will help them feel calm, then that's one thing. For some people, having the structure of an hour will then stress them out because they're always thinking about how much time is left in the hour. So for some people, maybe if writing music is something that he loves to do, then if he spent some time doing that, maybe a little less often, but he perhaps took a whole half a day doing it, so he felt sort of a little more space to do that, then that could help him sort of de-stress on a broader week-to-week level, something like that. So it really depends on the person. Some people would be able to sort of, in between a transition of, maybe a lunch break at work or in between classes or something, be able to bring out a notepad and spend 15 minutes writing music. But if that's something that's hard to transition in and out of, then I think that's something that's the case-by-case basis. Okay. Okay, I know you're not supposed to say great question, but these are really good questions. I'm dealing with a teen whose perception increases her anxiety. Challenging her perceptions often leads her to feel she isn't being supported or makes her feel bad about herself. How can we help her challenge her perceptions? That's a really good point, because I don't think I mentioned yet that for some of the people I've worked with, just feeling heard and understood can help them in their moment of anxiety, because if they know that they're not crazy, or whatever word they're placing on that, or they know that someone is on their side, then that's one step for them feeling a little more calm. So I'd say for someone who, if you're challenging their perceptions and they don't feel supported, I'd say try to spend a little more time just exploring those perceptions and investing time in just understanding it and really communicating to the person that you do understand it. And this might take a lot of time. And so, but I'd say invest that time, because then they will trust you, or they'll feel heard a little bit more. any time that you can have someone come up with the shifting of their perceptions themselves is helpful, but I realize that this isn't always as possible. So you might also try something such as brainstorming style, like you're not saying here's your perception and here's the correct way to see it. Not that I'm saying that you are doing that, but that might be how the person may feel. But look at a perception of a situation and try to brainstorm all the possible ways you could look at it, and perhaps coming up with many ways could help a person recognize that there are a lot of different options. Let's see, next one. Okay, I have just, it looks like more a comment here, but worth sharing. It's having a 17-year-old who was going through puberty, and that was especially challenging, and he's doing a lot better now because his body chemistry is calming down. I mean, that's another great point to bring up about the physical aspects of these things, that, you know, if we can break it down into thoughts and into body, but I mean, the thoughts are essentially things that are happening in your brain, so they're also completely intertwined. So acknowledging and recognizing that there are going to be periods of a person's life that are even harder than others, either because of their development or because of the circumstances that they're in. You might have someone that you know, or you specifically might be feeling like you're having more anxiety than you've had at a different point in your life. And perhaps there's a level of just acceptance to have about the current situation, to know, okay, this is really actually a stressful time, and so I'm going to accept myself and accept that I'm reacting in a way that makes sense. This is a lot to deal with. So good comment there. Okay, so how do you deal with actual words triggers like no or don't? How do we avoid usage, or do we change response? And who's in control here? Another great thing to think about. So if someone's reacting basically to a specific word, or even if there's a specific phrase, I've worked with people who really have trouble with questions in general, or perhaps I can imagine someone hearing the word no and just having a very strong trigger to that. I think essentially, especially as adults, we unfortunately have to work more on the response that that you're having yourself, or that the adult you know is having, because you can't change the people, all the people that are around you. Words like no or don't are just going to come up in a lot of situations. So I'd say practicing of mindfulness, if there's any sort of meditation, or as we talked about, sort of activity-based practice of just being in the present moment, of bringing your focus to something else, I'd say that's a really good skill to practice for specific triggers like these words. If you could hear the word and know, when I hear this word, the next thing I have to do is just like count in an in-breath 3 and an out-breath 3 before I do any response. So finding strategies that might help with that moment of trigger. Yeah. So let's see what we have. We have a great question about anxiety and sensory issues, how they sort of get tangled up, and it might be a little hard to figure out what's going on. I think that it's really, this is a good example of when it's helpful to sort of take time to sit back when you're not in the situation and perhaps write out what your experience of anxiety is. Perhaps try to spend a little time writing down in different columns, these are the thoughts I'm having, these are the sensory responses I'm having, to just kind of practice that awareness. That's going to be a lot harder in the moment, but maybe thinking back on it in another time can be helpful. And they're going to be different for every person, the way that the anxiety and the sensory stimulations could overload someone. So I'd say also pay attention to what you can change the easiest. So if the sensory stimuli are something that's really easy to sort of walk away from, or if it's an ongoing thing that could possibly be changed, then go with what can be addressed first. If the sensory things are something that keep happening, then see if you can address your thoughts of anxiety. So it's both examining what it is you're experiencing and also having sort of a more realistic look of, well, which things could I change most easily, perhaps, and going from there. So I have a question about medication when it's appropriate. I unfortunately don't feel super comfortable on the specifics of medication, but if anyone does want to look into medication themselves or for someone they know, feel free to send me an email. I can try to connect you with a psychiatrist to tell you a little bit more about those questions. Okay, so another question about the focusing on details. I have someone here who tends to focus on one thing and run with it down a catastrophic road, but can't recognize that this is what's happening. So how do you recognize when it's a real threat or not? So I'd say this takes a lot of practice. And this takes, again, like the question I answered before, it might be worth spending some time thinking about situations where you've done this when you're just sort of just sitting down in a calmer state. So in that sort of reflective moment, not challenging yourself in the moment to be able to fix things. I like to say that the first step of working on your anxiety is understanding it while you're in a very calm state. The second step is reflecting on it, you know, a few hours after it happens. The next step is reflecting on it right after it happens, and the next step is dealing with it in the moment. So allow yourself to go through those steps in sort of whatever timeline that happens for you. But I would say when, in terms of focusing on the details, I like to do things like writing out a list to see exactly how those thought lines are going, or writing out a sort of diagram. Some people see things more as sort of that sort of spider web cloud of thoughts. So try to diagram or write down the things that you're having, and for knowing whether or not it's an actual threat, try looking at the CBT concepts of unhelpful thinking styles and rational responses and see if some of those can help you directly address some specific thoughts. Okay, looking through the questions. Okay, another question about OCD with Asperger's and sort of the best way to stop the rituals that come up with OCD. How do you, similar to the last question, how do you know that the situation is not dangerous and there's nothing bad that will happen if you stop the ritual? And how do you stop doing this ritual every day? I definitely don't have as much experience specifically with the OCD piece and working with rituals, so I can't go too into detail on that. But I would say figuring out what that ritual is doing for you for sure, and deciding if you need to, you know, is there something else that you could replace that with that could help you feel calm? Again, like the other question, in the moment, this isn't going to change initially. You're not going to be able to address it in the moment probably, but reflecting back on the situations and coming up with some sort of plan of, you know, what's the situation, and do I know that in general situations like this are probably not risky, and maybe categorizing that ahead of time could be a little bit helpful for you. So suggestions, someone's asking for suggestions where in Central Mass a young adult with AS can get out of the house and do relaxing art. If people want specific suggestions of who to connect with and what sort of organizations are out there for group programs or therapists, definitely send me an email. I'll have to do a little bit of research. I don't have a lot off the top of my head, but it is really helpful to sort of get out of the house and do it. But then also, if there's sort of a space in the house or a plan, or you have the supplies ready, you can also do some of these things in the house as well. Okay, the questions again. Oh, someone gave me a good reminder. We have a artist collaborative open house this Saturday. It's 12 to 6 at the AANE office in Watertown. So any of you who are interested in doing art, I definitely recommend you come join us. We're actually having a Zentangle mural project. So thank you to that person who reminded me to mention that. Not in Central Mass, but out in Watertown on a Saturday, so for some of you might be able to make it out. And to come and see the Artist Collaborative and hear about how they use art either just more professionally or in a therapeutic way, and see some of them making art, but also we're having a photography workshop as well. It's called smartphone photography, and so you can practice taking better pictures on your smartphone or join us in that sort of Zentangle mural experience, maybe experiencing what I described before about getting lost in the process of art making. So coming back to some other questions here, someone has a son who studies in Boston and having a lot of anxiety about social life and can't seem to connect with other people, especially girls. And mom thinks that he's really great and handsome. So, I mean, this is a big question too about sort of the social anxiety piece of things, and also the sort of distraction of if this person is studying and focused on schoolwork, that can also be possibly a anxiety-provoking element as well, depending on the person. But I'd say taking little steps, little by little, in terms of social life, especially if someone is in a school, if there's some sort of club or something through the school that's more structured, anything where there's a way of sort of predicting how it might go or what's involved in the activity or the gathering could be helpful for someone who gets a little bit more nervous with the nuances of just the unstructured sort of connecting time. So if there's any sort of club or activity-based thing, I'd recommend that. Let's see. Okay, so what about anxiety related to irrational bullying experiences? I have people of all ages still feel affected by their either current or very far in the past bullying experiences. And so this is just a time where you can sit back and realize how your anxiety responses and the thoughts you have, the assumptions that you have about what might happen or what people are really like are based on your experiences. And this makes a lot of sense because that's what we do. We look at our experiences, we look at what we know, and we try to take advantage of that information, and we try to protect ourselves by knowing, what we might expect from people. So I would say really spending some time identifying that the person who's feeling like they're reacting to the bullying experiences, identifying that that is a reaction to those bullying experiences, so that in the moment when thoughts come up or anxiety comes up, there's a sort of go-to concept of this is a reaction to something that happened 10 years ago, and that's valid, but can I consciously remind myself that's about 10 years ago, not about right now. You perhaps might be also talking about a more recent bullying experience, and so that gets a little bit more tricky in terms of you get a lot into sort of self-advocacy and figuring out how to remove yourself from a situation or stick up for yourself. And so I think, again, it's another time to sort of step back and reflect and figure out what to do while you're not in this current situation. Question about online counseling or Skype. If I offer it, I do not at this time. We will definitely email you if something like that becomes available. Reading through the questions still. Okay, so we have another question here about how do you help people who have an experience where they think they're dying or having a sort of extreme concern about their medical condition, but then they get medical testing that proves that they're okay, and this also affects them to sort of choose not to leave or do family functions because they don't feel well. There's a lot of elements here. One is checking in. So first of all, I want to actually go back to a question we got before about validating people's experiences. I think especially the medical piece can be really sensitive because understand that whatever it is this person is experiencing physically is real for them, and that makes it real. and maybe it's being interpreted in a way that's not medically accurate, but they are feeling something physically as well as sort of mentally. They're having a response. So anything you can do to say, I understand that you're experiencing this. We've determined that it's not a danger, but I understand you're feeling it, and that's really hard for you. Someone on the spectrum might either experience really low sensory awareness and not feel things that actually might be more concerning about their health, but some people feel exactly the opposite, where they will feel sensory sensations in their body to such a high degree that it does feel a lot worse than it would for someone else who is having sort of the same thing happening in their own body. So I would say checking in with the thoughts that are going along with that. I actually want to mention that in the handout that you guys will receive via email, I linked a really good health anxiety set of worksheets that I found online, and it's sort of a multiple week program that a person can walk themselves through, but it might be helpful even yourself or the person you're talking about to read through just some of the introduction pieces of the materials, and it gives you some sort of structured framework of talking or writing about the thoughts you're having about your health anxiety and strategies of how to test whether those are something to be concerned about or not. And then, of course, too, honoring that some people really experience their anxiety on a really physical level. So, what came first, the chicken or the egg? Is it the anxiety that comes first and causes the physical experience, or does the physical experience come and then they start communicating together and building up the experience to a point where it's really hard to do something like going to a family function or doing something social? So look for that resource on that topic. So another question, have you had success with visualizations, maybe with a memory to feel calm? Visualizations are different for every person, so I say it's worth giving it a try. You might try something that you're especially interested in, because again, if I tell you, okay, sit and picture a calm river, and you really haven't spent a lot of time out by rivers, and that's nice, but it's not something you connect with, it'll be harder for you than if perhaps you've spent a lot of time at the beach. And so I say, well, picture the waves in the ocean. So know sort of what you might connect with, but also check out online, especially YouTube. Just type in guided visualization, maybe a bit about type in for anxiety, things like that. There's so much to explore, so sort of just play around with that, see what might help for you. I think that it really depends on the person. If you're a very visual person, then it could be really helpful, because if you're experiencing your life and your memories as sort of looking at the images of them, then that's the part of your mind that you might want to engage, because it's the part that's really active. All right. Okay, so how can you overcome avoidance? An adult with Asperger's avoids certain things, especially intimacy, because other rituals are more important. So, I mean, I think that this too is going to come a lot to sort of, if something is feeling more important to the person than something else, then there's only so much an outsider can do to sort of convince them to look at things a different way. So maybe just starting even with noticing rituals or strategies that are invasive to things that they could be experiencing in life. Maybe sort of fine-tuning those rituals so they don't need to be happening as often, or there's something that is a little bit more accommodating to, something that they can do at work to calm themselves down or in different situations. I think avoidance is a really slow process, and it really does have to be, the person themselves has to be really motivated themselves, because any time that you feel pushed to experience something, that's going to multiply your anxiety quite a bit. So there does have to be sort of a previewing of the situation and an explaining and understanding of how it might be helpful, and that person has to really feel like it's, and know that it's their idea to confront something that they're feeling avoidant about. Okay, questions? Okay, how long is it reasonable to give someone a break when they are supposed to do a task and says they're too anxious to do it? That's a really good question, and of course very case specific. I would say experiment with people. There are certain tasks that really just need to be done by a certain time, and so setting those boundaries when that is really clear, when there's really something that you need to do. But also sort of previewing with people of saying, this is something I'm about to ask you to do, or this is something that you need to do in 5 minutes, and so this is, you get 5 minutes or something like that. So giving some sort of time in between where it's, you need to do this now, but you get a little time a little bit before you say, right now, this is what you need to do. Oh, my email is not on this slide. Someone just popped up with that. My email is my name, tanya.white@aane.org, and it will also be included in what you guys receive via email. But it's my name, tanya.white@aane.org. So I'm going to scroll through quickly. I know we're running up close to the end here. If I don't get to your questions or you didn't get a chance to type them in, you can definitely email me with those questions, and I will do my best to answer them. Okay, breezing through a little bit here. So a little suggestion here, something someone's learned, they've helped their son use affinities presented by his initial habits, focus, and compulsions. Several year interest has now led to Japanese language instruction and a real interest in Japanese culture and possible travel. So nice, good example of the interest becoming a positive thing. And let's see, one last question. Is it common for anxiety to increase for Asperger kids when they get or go through high school? Sometimes, or it seems that some of the stuck or disengaged behaviors are more prominent now than before. Any ideas on how to address preemptive instead of reactive as they progress through high school? So I want to refer back to, so the puberty comment of the different hormones going on in the person's body at this time. Again, of course, any previewing of what high school is going to be like is helpful. Any sort of creating of structure of, visiting the classes, of seeing what things are going to be like before you get there. Also honoring that this is a really tough time for a lot of kids, for a lot of teens, of just getting to both a new situation. Perhaps the high school is also a lot larger. There's a lot more responsibilities involved, so allowing for that transition time as they start to learn some responsibility. And then even post-high school, there's new sets of responsibilities as an adult. So again, previewing and talking through with them about what it's going to be like, and also sort of allowing for that process. I think we do have to wrap up, and Joanne wanted to say a little bit. Are you?
Yes.
Are you online, Joanne?
I am online. Good. So I've been sitting back listening to the questions. So Tanya, thank you so much for doing this presentation. I know I've been taking notes myself through it, and I'm so glad that we've had the full half an hour that we can spend with you answering the questions. And I did want to mention. So Tanya, if you, the black box is reared its ugly head yet once again. Oh, it's going away. Yes. So I did
it went away. Okay.
This last slide, and it's our AANE resource slide. And so, as Tanya was saying, if there are questions that you have that she wasn't able to get to today, or you think about at a later time, feel free to contact either her at the email she'll provide, or contact AANE. And in addition to that, these are some of the programs that we offer for adults and for their families, and they range everything from the consultations and the social groups to workshops and webinars such as today's. And then we do have an on-demand video library that can be accessed through our website, and that will have this video along with past webinars in it. So again, thank you very much, Tanya, for today, and we are all done. Have a good afternoon, everyone.
Okay, thank you, everyone.
Bye.